Hello. My name is Jones, and today we are continuing with the aspect of inflammation, and now we are looking at the healing process. Okay, so healing process is the final phase of inflammation response. Healing is the process of regeneration or repairing of the injured or the inflamed cells. Healing has two stages. We have the regeneration and the repair stage. Okay, in regeneration, there is replacement of lost cells and tissues with the cells of the same type. The ability of cells to regenerate depends on the cell type. Like we can have the skin cells, the lymphoid cells, the bone, from the bone marrow. That's where some cells are also produced. So from the bone marrow, the neutrophils, they'll be replaced. We have the mucosa membrane, we have the liver, we have the pancreas. So if that is where the injured was, there can be regeneration. Okay, then the other stage in healing is repair. Repair is healing as a result of lost cells being replaced by connective tissue. So here, these new cells that have been produced, then we have the connective tissue that tries to put them together. So repair is the most common type of healing process and result in some scar formation. There are three phases of healing. So there is the initial phase, there is the granulation phase, and there is the maturation or scar contraction phase. Okay, there is the maturation phase. Okay, so the initial phase, we are just looking at the inflammatory phase. Okay, that is happening within 3 to 5 days. The incision area fills with the blood from the cut blood vessels in the initial phase. Okay, blood clots are going to form, and also platelets. Platelet release growth factor also begin to help within the healing process. Okay, that is the platelet release growth factor. They will help in the initial phase with the bring about the healing process. The area of the injury composed of fibrin, clots, erythrocytes, neutrophils, and other debris. You will find that these they will accumulate within the tissue space. As the wound debris is removed, the fibrin clot serves as a meshwork for future capillary growth, migration and also migration of epithelial cells. So when you are looking at the phases of healing, there is the initial phase, which is the inflammatory phase. Then the other phase is granulation phase. That may take 5 days to about 4 weeks. The components of granulation tissue includes proliferation of fibroblasts, proliferating capillary sprouts. Okay, there is the angiogenesis, we have angioblasts that are going to form. We just simply have new blood vessels that are going to form at an area that might have suffered some injury or had some inflammation. There will be various types of white blood cells that are going to be there, the exudates and the other loose semi-fluids and ground substance that can be seen within the granulation phase. Okay, so in time, the collagen is organized and restructured to strengthen the healing site, okay, at this stage in the granulation phase. Okay, and it is the collagen is termed as the fibrous or tissue scar. Okay, so it comes during granulation. There is more like a scar that starts to form because of restructuring that is happening. Okay. Organized by the collagen. During the granulation phase, the wound will look pinkish and it will be highly vascular. Okay, numerous red granules or young budding capillaries can also be seen. Okay, because of angiogenesis that is happening during a granulation phase. Surface epithelium of the wounds are going to regenerate, and in few days epithelium connects both sides and begins to mature, and you're going to see that now the wound will closely resemble the adjacent skin. Okay, so in granulation phase, we are saying the component of granulation tissue, including proliferation of fibroblasts, proliferating of capillary sprouts, and various types of white blood cells, okay, and other immature connective tissue are going to migrate to the healing site and secrete collagen. So it is because of this collagen that now there is organization and restructuring and also the strengthening of the healing site. Okay, and this is going to help in the formation of the fibrous or the scar tissue. Okay, then the third phase of healing is maturation and scar contraction. This may happen on the 7 to several months. The collagen fiber are further organized to help in the remodeling process. So in maturation phase, there is remodeling. You find other authors who look at it as the remodeling. Okay, so maturation phase and scar contraction. So the scar is being contracted, it's being remodeled. So the active movement of myofibroblasts cause contraction of healing area and help to close the defect and bring the skin edges close together. A mature scar is formed and a mature scar is formed, and this will now lead to more of a pale appearance, okay, at the scar area. Okay, so these are the phases of healing: initial phase, granulation phase, and maturation phase. So within maturation phase, we have talked about remodeling of the scar. Okay, types of wound healing: there is primary intention and also healing by secondary intention. When you say wound healing by primary intention, the wound that has been produced with a surgical incision or paper cuts, okay, you see that it will have sharp edges that can easily be approximated. Okay, so when wounds that heal by primary intention, let's say after surgery, use of the surgical blade and the likes, okay, they heal very fine, less likely to see complications, and the scar that forms is very, very minimal. But when you're looking at wounds that are going to heal by secondary intention, you see that these are produced by trauma, ulceration, or infection. So it will have a large amount of exudate, and if it has a large amount of exudate, you're going to have irregular edges of the wound. Okay, this then will lead to extensive tissue damage. So there would be greater defect or gap in the wound edges because of the type of wound that we have that is healing by secondary intention. So secondary intention, you need granulation of tissue to cover up the scar area. Then healing by tertiary intention. Here we are looking at delayed primary intention or contaminated wound that is left open, and if it is left open, then infection is going to settle in within that wound, and it will delay the healing. So the scar becomes larger and deeper than other intentions that we have talked about. Intentions, that is the wound healing intentions that are there. So types of wound healing, we have by primary intention caused by sharp object like surgical blades, okay, and leave minimal scar, less likely to be contaminated. Then we have secondary intention where it does not have sharp edges, healing by granulation. Then tertiary intention, these are infected wounds that leave a very huge scar. Okay, so wound classification. Wounds can be classified based on depth. Wounds can be classified based on the color of the wound. Wound can be classified based on the time of healing. Okay, so when we say wounds can be classified based on depth, we have superficial wound, meaning it's just affecting the epidermis. Then we have partial thickness wounds, meaning the wound extends to the dermis. Then when we say full thickness wound, or the deepest layers of the tissue are affected, and we are looking at the bones or the other tissues below the dermis. They are involved. Okay, so that is the full thickness burns. So we have said wound classification. Wound can be classified based on the color of the wound. So we have red wound, you have yellow wound, and then we have black wound. So red wound, this can be superficial wound, which is clear and pink in appearance, with a possible cello-sanguineous drainage. Then when we are looking at yellow wound, here there is presence of slough or soft necrotic tissue. Okay, liquid to semi-liquid slough with exudate drainage from the wound site can be seen. Okay, with some kind of creamy ivory or to yellow kind of material, that is the pus. Okay, can be seen. So this is the yellow wound. Then the black wound, here we are looking at a blackish, grayish or brownish adherent necrotic tissue that can be seen. Okay, you know, patients sometimes go for slaphectomy. So this is a candidate of wound which is which may require slaphectomy. So in the black wounds, there is black, gray, and brown adherent necrotic tissue, which is called eschar. Okay, then the possible presence of purulent drainage is also seen in black wounds. So the types of wounds, we have red, yellow, and black. Okay, so wounds can also be classified based on time of healing. So to do with time of healing, we can just talk about acute wounds. Okay, so those that are going to heal within less than 3 months. Then chronic wounds, those that will last more than 3 months. Okay, so let us now look at factors that may delay wound healing. Okay, so there are a lot of factors that we can talk about here, but I'll try maybe just to stick to 11 factors that may delay wound healing. So we can say nutrition deficiency can delay wound healing, and this can be broken down into certain nutrition components. Like when I say, if within the nutrition one is lacking vitamin C, it will lead to delay of formation of collagen fiber and capillary development. That is the angiogenesis that happens with at the wound site to create new blood vessels. Then when you look at a nutrition components like proteins, they help repair worn out tissues. So there will be decreased supply of amino acids for tissue repair and replacement. Then when you look at a specific nutrition component like zinc, okay, if zinc is not present in one's nutrition, there will be impaired epithelialization. Okay, so that is just on nutrition. Then we can also look at inadequate blood supply as the second factor affecting wound healing. So if there's inadequate blood supply, it will decrease supply of nutrients because blood carries with it nutrients. Okay, so this will then decrease the healing process and will increase the likelihood of the wound being infected. Okay, so the third factor that may delay wound healing is use of corticosteroids. Corticosteroids impair phagocytosis, inhibit fibroblasts, and depress formation of granulation tissue. Okay, so there are some people who are into weightlifting and then they tend to abuse corticosteroids. So please remember that it may impair phagocytosis, inhibit fibroblast, and depress formation of granulation tissue. Okay, so as we have been mentioning throughout this presentation on what may cause inflammation, so factors that may delay wound healing, when we look at the types of wound based on when you look at the types of wound based on when said based on depth, if the wound is quite deep, okay, and involving deeper tissues, you find that it can easily be infected. And when you look at types of wound based on time, you find that most chronic wounds are wounds that have been infected. So infection hence plays a role in delaying wound healing. Okay, infection may lead to increased inflammatory response and also bring about tissue destruction. Okay, the other factor that may delay wound healing is smoking. Okay, in particular, when we talk about nicotine, it's a potent vasoconstrictor that may impede blood flow to a healing area. Other factors that may affect wound healing is mechanical friction. Okay, mechanical friction destroys granulation tissue, okay, and prevents approximation of wound edges. The wound is healing, you keep on removing the collagen material, you keep on moving the immature scar, so that may bring about the mechanical friction, okay, which then delays wound healing. Okay, you might find out that the people in advanced age, above 65 and the likes, mostly it's not highly recommended that they go for surgery because of poor wound healing. So advanced age affects the wound healing because there is slow collagen synthesis by the fibroblasts. And also when you look at advanced age, there is impaired circulation, as wound healing requires good supply for proper healing to take place. The other factors that may delay wound healing is obesity, because of decreased blood supply to the area because of increased underlying fats. And in obesity, there is likelihood of low immunity. But otherwise, we are saying because of increased underlying fat, it may affect the blood supply and circulation. Okay, the other factor, or the ninth factor that we can talk about that may affect wound healing is diabetes. Okay, when one has diabetes, there is decreased collagen synthesis. Okay, and there will also be retarded capillary growth. Okay, and also phagocytosis is affected. Okay, so if one has diabetes, also oxygen supply to the wound can be affected because of increased viscosity of blood. Hence, blood in some certain small blood vessels may not easily pass nicely because of increased viscosity. Okay, the other factor that may affect wound healing is poor general health or reduced immunity. Okay, if one has reduced immunity, there will be absence of healing factors, or there will be reduced or delay in mobilizing the healing factors, the factors that need to help the wound to heal. Maybe the other factor that we can also talk about as a factor that may delay wound healing has to do with conditions like anemia. Okay, so anemia will bring about less supply of blood to an area, leading to also less supply of oxygen. Okay, so now let us look at some of the complications of wound healing. So the complications of wound healing include adhesions, includes contractions, include dehiscence, include evisceration. It may include hypergranulation or big scar. It may include infection, hemorrhage, fistula formation, okay, hypertrophic scar, which I've mentioned, and then also keloid formation. Okay, so these are some of the complications of wound healing. Okay, remember when say adhesions, that is 2 layers sticking together. Okay, a band of scar tissue that form between or around the organs. So it can be maybe between the pleura, or it can be after intestinal obstruction. You do that, there can be some kind of adhesions that may happen. Then to do with contraction as a complication of wound healing. Wound contraction is a normal part of healing, but complications occur when excessive contraction results in deformity. If there is excessive contraction, okay, during the healing process, then you have deformity. So contraction becomes a complication of wound healing. Dehiscence, we are just looking at separation and disruption of previously joined wound edges. This can be as a result of infection, obesity, okay, or a pocket of fluids that was left within the surgery, or granulation of tissue that is not strong enough. So it may lead to dehiscence. Then evisceration occurs when wound edges separate to extent that intestines protrude through the wounds. Okay, so then the other complication is excess granulation tissue, which I've mentioned, ground fresh and the likes. Excessive granulation tissue can protrude above the surface and cut or cauterize. Okay, and then healing continues in a normal way. Infection is a complication of wound healing because of compromised skin integrity, which is involved in the body's immune system. Then keloid formation, here looking at great protrusion of scar tissue that extends beyond the wound edges and may form tumor-like masses or scar tissue. Okay, so these are the complications that I can talk about of wound healing. Okay, so the nursing management of these patients, we have talked about it. Okay, what you can do for nutrition and the food components that you need to source to help the patient to heal. Ensure you manipulate the environment of the patient to facilitate recovery. Remember that hygiene is important to prevent infection. Okay, coming in contact with the wounds. And then healing has also when we talk about wound healing, it has got pharmacological and non-pharmacological aspect in the way you can monitor. So when you're looking at pharmacological aspects, you can give corticosteroids. They will help reduce inflammation because they will help in the mobilizing of white blood cells. Antipyretics because of fever that can be seen. Antibiotics cause of infection that can be seen. We can have platelet-derived growth factor also given as they stimulate cell proliferation and migration. Okay, then there are also other recombinant drugs that can be given, okay, to promote platelet aggregation or stimulate wound healing. Okay, so I would also want to talk about the hyperbasic oxygen therapy, where highly pressurized oxygen can be administered to a part that has got a wound in order to kill anaerobic bacteria. Okay, so we were looking at the fourth stage of inflammation, which is healing. Okay, so we have discussed within this lesson that healing has two stages. It has regeneration stage and repair stage. Okay, then healing has three phases. There is the inflammatory phase, there is the initial phase which mostly composes inflammatory phase. We have granulation phase, which mostly includes cellular response. Then we have maturation response or maturation phase, okay, where there is remodeling of the scar of the patients. Then we looked at types of wound healing. Types of wound healing, we said there is healing by primary intention, healing by secondary intention, healing by tertiary intention. Then we went on to classify wounds, and we said they can be classified based on depth, that is superficial, partial, and full thickness. Based on color, we just have red, yellow, and black wounds. Then based on time, we have chronic and acute. Then we went on to look at factors that may delay wound healing, and then lastly we looked at the complications of wound healing and also looked at the possible nursing care points, okay, that we are supposed to look at. Okay, so from me, I'm saying keep studying, and let's overcome this virus called ignorance together by studying together and ensuring that we listen thoroughly to all the lessons. So please keep studying.